What are the biggest challenges to being able to offer effective immunotherapy options to AML patients?
A large challenge in AML to date in terms of immunotherapy is we haven't found drugs that are really effective. And we haven't found drugs that are effective that offset the different added toxicity that these medications can cause. So right now we're trying to identify markers and ways to predict which patients could respond to immunotherapy and who are the appropriate patients for that.
Yeah, so I think that it's a great question, and I think that part of it is, the part of the challenge really comes down to being able to target the AML cells. And so some of it is really a matter of biology and technology development and research that's still, kind of ongoing. I truly wish that, I want to, number one, I ideally want to make something as complex as and challenging and risky as bone marrow transplant obsolete. I think we would love to do that. But the reality is it's a huge component of our treatments and will be, I think, for some decades to come because it's just so important. But ideally, we want immunotherapy to be much more targeted and much safer. And that process is ongoing. And ideally, of course, we'd even love to make chemotherapy obsolete, right? And I think that, and we're doing that to some extent, with our therapies being more and more targeted. But if we, in the future, are able to use the immune system in a smarter way to really more specifically target leukemia, get rid of it, that would be, of course, ideal. But there's so much that has to happen and so many challenges in terms of how similar these cells look to normal cells. I should have mentioned in our CAR T cell trial right now, for example, we are really seeing that using that, ideally in the inclusion criteria for the trial as a bridge to bone marrow transplant. So even if we are wiping out, hopefully the bad cells, even if we wipe out a lot of the good cells, that's okay in that setting because we have a plan in place to get the patient to a bone marrow transplant. So that's part of the challenge, is really distinguishing the bad leukemia, from the normal cells.